Hello, I'm Professor Andy Bilson. I've been coming to Bulgaria for over 25 years and working alongside friends and colleagues, many of whom are here today. So I'm very sad that I'm unable to be with you in person due to health problems. Today I'm going to talk to you about the importance of parent advocacy to create an effective child protection system. I'll start by covering some current trends in child protection in English-speaking countries. These countries have a particular approach to child welfare which focuses on the idea that harm to children stems mainly from parental actions. They ignore the policies and actions that make parenting more difficult, such as increasing child poverty, inadequate mental health services, poor housing, and insecure work. This leads to a system that focuses on identifying risk of harm and investigating parents. I'll discuss the impact of this on children and families before going on to consider why promoting parent advocacy is an important element in moving to a system that is more effective in promoting children's welfare. Many other countries are increasingly adopting this Anglo-American approach, including here in Bulgaria. I'll argue that this approach neither protects children nor promotes their well-being. Instead, it leads to very high levels of scrutiny of poor and excluded minorities. For this reason, it's important to change the way we respond to parents. I'll now look at a trend that I've called the investigative turn. This has taken place during this century and is leaving child welfare systems in crisis. Across the English-speaking industrialised countries, a common trend in child protection has emerged. In recent years, in country after country, increasing numbers of children are drawn into the child protection system and their situations investigated for possible abuse by parents. The latest data shows that in 2022 in the USA, 3 million children were investigated by child protection workers. That's 1 in every 24 American children in that year alone. Only 16% of investigated children were found to be abused, and the vast majority of these were said to be neglected, a finding that often mistakes poverty and its impacts for abuse. Additionally, 2.5 million families were investigated but were not abused. People sometimes say that these wrongful accusations are a price worth paying, though it must be said that these are people who haven't been through the trauma and fear that a child protection investigation causes. Accusing parents of harming their children causes serious harm to families and the children whose well-being we're trying to promote. Similar trends are taking place in other countries that are following the lead of the United States. In Australia in 2023, 3.15% of all children were investigated, and 75% of investigations found no abuse. In England, the annual figures are slightly lower. Again in 2023, 1.65% of all children were investigated, and 72% of investigations were found not to be founded. However, these annual figures hide the high and growing rates of involvement over time. In the USA, a whopping 37% of all children experience an investigation by child protection services during their childhood, and 25% in Australia and New Zealand. In England, there aren't yet figures for the number of children investigated, but my as yet unpublished research shows 42% of children are referred to children's services, and 25% need services because they are in need and require state help to achieve a basic level of child well-being. For a high proportion of these children, the services will be a child protection investigation. Furthermore, these investigations are concentrated in the most deprived areas and excluded communities. In the United States, over half of all African Americans were investigated for potential abuse during their childhood. In Australia and New Zealand, this happened to high rates of Aboriginal children. Here in England, children in the most deprived tenth of the country are 10 times as likely to be on a child protection plan or in care. Estimates based on my new, as yet unpublished research suggest that in the most deprived tenth, around 80% of all children will have been referred, and more than half found to be in need and require services to achieve basic welfare. The investigative term, with its large increases in child protection investigations, is accompanied by reductions in support for families and large increases in children in care and placed for adoption. England has seen a 50% increase in the numbers of children in care or placed with adoptive parents in the last 10 years. Despite, or maybe because of these high levels of intervention, these rich English-speaking countries have low levels of child well-being relative to other affluent countries. A brief video which will show the impact of a child protection investigation on a parent in their own words. This was a case of a mistaken bruise which turned out to be a birthmark.
Amy Agnew found a blue patch on her baby Scarlett's foot.
I took her down to A&E as advised by 111, and then obviously it just went from there to basically a life of hell. They were just pointing the finger straight there and then that I was basically an abusive parent, and if it wasn't me who'd done it, then it was obviously somebody else.
Straight away, social services in Sunderland removed Scarlett from her parents' care.
My worst nightmare was when the term ends, they would take her off office for 3 days and I wouldn't get to see her. I've never been investigated by social service, none of my family has either, and that's what they said. They couldn't understand because we had like a clear history and every one of us were.
The hospital never did get to the bottom of what was assumed to be just a birthmark, but Scarlett was allowed back home.
All I did was cry, I didn't sleep. You just actually start to doubt yourself as a parent, like your skills and everything. You're just terrified of actually doing anything because you think that somebody's going to take them away when you know you've done
so we see
something
here
personally wrong
a
with yourself.
major impact on this family, and I've seen this and much worse from parents who've been put through an investigation. They lose sleep, they struggle to get on with their lives as normal, and this substantially affects both them and their children. The high rates of investigations and removal of children that we've talked about before can only be justified if this approach to child protection actually protects children. Perhaps surprisingly, there are a few studies that consider whether this is the case. The only major comparative study of the outcomes of child protection systems concludes that this approach to child protection does not protect children in this way. It covers 6 countries and was undertaken by Gilbert and colleagues. The study used data from hospitals, police and child protection systems in 6 countries, including the US and the UK, to consider the trends in physical abuse and neglect, focusing on children younger than 11. Their conclusion was that our results show no clear evidence for an overall decrease in child maltreatment, despite decades of policies designed to achieve such reductions. My own research in Western Australia, covering a period of 20 years, showed that despite major changes in policy and increases of children being investigated and taken into care, there was no change whatsoever in the numbers of children suffering significant harm. Similarly, in England, the number of children suffering serious harm or death have not decreased, despite child protection investigations having increased from 89,000 to 225,000, 250% increase since 2010, and the number of children in care or placed in adoption having increased by 60% over the same period. Professor Nigel Parton, an internationally renowned commentator on child protection systems, considered international comparisons of policies and activities in child protection. He explains the lack of impact, saying that the developments of child protection policies and practices are only very loosely connected to responding to the social problems of child maltreatment. So, why do we need to promote parent advocacy and participation? Firstly, parent participation and advocacy fundamentally challenges the culture of child rescue, which is at the heart of the investigative turn. This is because the rescue culture others parents and makes invisible the importance of family life, even where families live in the most difficult of circumstances. Secondly, it can lead to fewer children needing to be in care. In New York, there was a movement that promoted parent advocacy and parent participation, which included activities from political campaigning through to parents supporting other parents when their children were involved in the child welfare system. This was associated with a reduction in the number of children in care from 50,000 to the current level of around 8,000. Having parents involved in planning and supporting services means that they can be designed and undertaken in a way that meets the real needs of parents and their children. And this leads to more effective services. Many areas of children's rights revolve around engagement within their family. Parent participation is fundamental to promote children's rights and human rights more generally. And importantly, it ensures better outcomes for children over the long term. Helping to develop stronger, more loving families is at the heart of our child protection systems. Parent participation and advocacy helps to achieve this fundamental goal. So, what is parent advocacy? We think that parent advocacy is when parents who have been involved in the child protection system participate in and influence the decisions that affect their lives. This includes three linked and overlapping areas. Case advocacy is where increasing parent participation in decisions that relate to the case management of the child. This includes providing advocacy when a decision to remove a child from parent's care is actively considered, playing a role in the development of a case family support plan, and making ongoing decisions on a child's care, such as healthcare or education. For example, in the UK, Talia, who will speak later, is a parent whose child was taken into care and who successfully challenged this. She now advises other parents on how they can avoid the need for their children to be removed, gives advice on what help is available, and provides emotional support for parents in difficulty. The second area is program advocacy. This includes parents working as trained parent advocates in child welfare agencies, providing, for example, prevention, family support, out-of-home placement, and legal assistance. Parents help to design, plan, evaluate, and strengthen the program, as well as to assist parents who are struggling to raise their children safely or to be reunited with them. For example, this might include parents who've had a child in an institution who turned their life around to get their child home. It includes these parents being trained and employed to help other parents who have children in institutions to get their own children home. Or these parent advocates might work with parents whose children are at risk of coming into institutions, giving them practical support, advice, and other help to keep their children in their own homes and families, and working to make sure that their views are heard by social workers working with them. In the USA, there are programs where parents who've overcome a drink or drug problem and are now sober are employed to mentor and support parents with drug or alcohol problems and help them to become sober. They work alongside social workers and psychologists who need their support because parents in difficulty find it easier to speak to and trust someone who has had a similar difficulty, and it gives them hope to know that these problems can be overcome. Third but not least, policy advocacy. This involves parents acting politically to change policy legislation and improve resources for family support, participating in governmental and NGO advisory boards, speaking on panels at conferences, teaching in classes of social work and law, writing about their experiences, and it also involves working at the grassroots and community levels to advocate for child protection reform. Parent advocacy was developed as a formal set of programs in New York during the 1990s. Parents started to help each other, and alongside professional allies, they worked to bring about change. They successfully reformed the New York child welfare system. and the number of children in state care from 50,000 as it was then to the 8,000 we see in care today. This is because parents are the experts on their own situations and needs, so involving them in planning and providing services leads to better outcomes. New York's parent advocacy now takes a variety of forms. It includes a range of programs that employ parents who had regained children from state care and overcome problems such as alcohol or drug abuse. They are employed in various areas of the child protection system to advocate for other parents when they have difficulties that might lead to child protection involvement or to their children being taken into care. There is a growing literature on parent advocacy and participation in child protection. It's only a new area, so this will take some while to develop further. For the international review which I carried out with David Tobis, I did a literature review looking at over 100 papers. The quality of the research was variable, but it all seemed to suggest very real benefits of carefully planned parent advocacy. Many of the papers highlighted improved parent and family engagement in partnership with services. A small number of papers were able to demonstrate that there was a reduction of maltreatment, particularly where parents were offered support such as peer group work and telephone counselling lines. Some studies, which considered decision-making about entry to care, showed that there were reductions in the numbers of children who went into care. And similarly, children were found to return more speedily to their families when parent advocacy was available. In situations where parents were unable to care for their children in the long term, studies indicated speedier replacement with kin, such as adoption, and some studies focused on parent advocates working in the field of drug and alcohol use. These showed that having parent advocates supporting parents with these problems was more effective in promoting sobriety than simply providing alcohol and drug services without them. Finally, and an important finding was that when parents were working in child protection agencies, this led to agency culture change, with much more focus on partnership and a move away from child rescue. So, how might we develop parent advocacy in a country such as Bulgaria? I'll suggest a few ideas, and here in Bulgaria some steps have already been taken which you'll hear about later. All these activities should involve parents with lived experience in planning, design and implementation. Parents will also have their own thoughts on what should be done, so the first step is to consult with parents and involve them throughout in all aspects of the work. There are also likely to be groups of parents who are carrying out advocacy, so a first step is to identify what is already going on. Research into what's happening here in Bulgaria has been undertaken by the Know-How Centre on Alternatives to Care and will be presented later. Another idea is to develop a network for parent advocacy. In the UK, I'm co-chair of such a network, and I'll talk about this in the conference later. Parents are already experts by experience, though they can benefit from training in areas such as formal knowledge of the child protection system, speaking publicly, and working on the emotional aspects of helping others to find their ways through the system. So developing training may be an issue. A good starting point is to develop independent groups of parents to give advice to child protection systems in municipalities and in central government. Finally, developing pilots may also be a useful way ahead. These may be developed during deinstitutionalisation, for parents of children with a disability, for parents of children from deprived communities or Roma communities, and for parents who themselves have been in institutions. Here are links for the two resources that I've just spoken about. I'd like to thank you for listening.